Flu season is here early and it is raging. As a result, doctors say hospital beds are filling up at the fastest rate in a decade. But why is this year so different than years past? This afternoon, I posed that question to an infectious disease expert.
Peak flu season is still weeks away, but the number of cases is already trending higher in the U.S. than a typical January or February.
This flu season is hitting much harder and much earlier than we typically see.
Dr. John Goldman from UPMC says the level of flu is higher right now than all but one of the peaks seen in the last 6 seasons. It's sending more people to the hospital, as the CDC's rate of hospitalizations is 10 to 20 times higher than in an average year. Dr. Goldman says the reason is threefold. First, the H3N2 flu strain, which makes up about 80% of current cases, is more aggressive and causes more severe disease. Social distancing and other preventative measures used as protection during the pandemic also led to less immunity. Finally, Dr. Goldman says fewer people are getting the flu shot.
COVID vaccine hesitation has spilled over into something like the flu shot, which has been around for years, has an established safety record, and is a very safe vaccine.
Dr. Goldman says flu vaccination rates are down by 50% this year. This, as the CDC reports 300,000 COVID cases nationally and a continued spike in RSV.
What we worry about is that we're going to see a bad flu season, continued COVID, and more RSV than usual. So we're worried that our hospitals are going to get very busy.
Hospitals are bringing on extra staff to help deal with the influx of patients, but doctors say there's another solution to the growing problem.
We are also encouraging people to get their COVID booster shots, to get their flu shots, and do the things that they should do to try to keep themselves from getting COVID, keep themselves from getting the flu, and keep themselves from ending up in our hospitals.
And for patients with health conditions that could leave them vulnerable to severe flu, Dr. Goldman says the flu shot reduces the risk of death by 50%. He says the flu vaccine is about 50% effective at preventing the flu, but even if you get it, the vaccine will protect you from more serious illness that could keep you out of the hospital this holiday season.